Mental health has evolved tremendously over time. At some point in time, all Canadians will experience mental health indirectly, and about 20% will experience mental health personally. Mental health is a wicked problem. What does this mean? It means it's complex, it has no simple solutions, but not addressing this problem can have a serious impact on multiple sectors. Let's talk about these. Mental health has a clear economic burden. As mental health prevalence increases, the proportion of the population depending on the economy versus those contributing to the economy increases as well, therefore increasing economic burden. Just as poor mental health negatively impacts the economy, poor economic times negatively impact mental health. A vicious cycle begins to emerge where the increased prevalence of mental health condition causes greater economic burden and how economic downturn leads to further mental health deterioration. It's obvious that the health sector is not the only player involved. The workplace and economy influence mental health significantly, which emphasizes the importance of a multidisciplinary approach. We also see an overdiagnosis as a concern. People who do not have true mental disorders are greatly loosely diagnosed and subsequently treated due to the subjective nature of a mental health competing with the objectivity of a standardized Western medical practices. We see this with the evolution of the DSM-5. The overdiagnosis of patients in general can be draining on the healthcare system and the economy. At every level of education, whether it be primary, secondary, or post-secondary, mental disorders have shown to promote termination prior to completion. Mental illness has again proven itself a hardship through its ability to act as a barrier to education.
The economic burden associated with mental health is felt in every sector, not just healthcare. When we're dealing with mental illness, we know we also have educational and diagnostic issues. Now, this is a wicked problem, so there's no one right answer, but doing nothing isn't the solution either, and every step forward is progress that we desperately need. We need to tackle this from a policy perspective because that's where we're going to see the most return. Policy 1, we need to invest in child and adolescent promotion and support programs. Investing in children will allow these young individuals to learn how to manage their disease and grow up to be adults who can deal with their problems, cope, and become successful contributors to society. Second, we need to deal with healthy workplaces. Promoting to employers to keep their teams mentally healthy will reduce absenteeism, promote productivity, and retain individuals in the workplace, therefore retaining economic contributors. Third, we need to deal with this diagnostic problem. And the answer seems pretty simple. You need to tighten the diagnostic criteria. You need to make more objective, more user-friendly tools so that the right people are getting the right diagnosis and the right treatment, and we stop wasting government time and money. Lastly, we need to deal with the educational aspect. We know that mental illness promotes termination prior to completion at every educational level. So investing in mentally healthy initiatives at every level of education will allow people with disorders to finish their education, move on with their life, and become successful contributors. Now, we need to deal with this from a provincial level because the provinces are the ones in charge of education and healthcare. But aside from that, even if these solutions are completely successful, we know that they will not cure mental illness. They are steps forward, steps that we desperately need. It's not the end, but it's a good beginning.